Hello, my name is Marianne Scrabble, and I'm a faculty member at Creighton University School of Pharmacy and Health Professions. And I'm excited to introduce our poster from the AACP Virtual Pharmacy Education 2020 meeting for this year. Our poster is titled "How Should Schools Better Prepare Students to Combat the Opioid Crisis? Results from Student Focus Groups." And I worked on this project with colleagues from across the country from both the experiential education section and the substance use disorder SIG. So along with me from Creighton, I had Laura Palumbi from Minnesota Duluth, Cynthia Konak-Sharp from Purdue, Trish Devine from Butler, Sarah Spencer from Binghamton, Amy Tiemeyer from St. Louis, Kelly Coover from Creighton, Paul Walker from Michigan, Twin Win from Minnesota Duluth. She was a 2020 graduate that worked with us, and Tran from Midwestern in Chicago. So again, thanks to my colleagues for their collaboration on this project. We still have work to do as we have a lot of data that came through, but this poster introduces some of our initial work from it. So as you guys know, the opioid crisis is a public health emergency. And so these groups came together to try to answer the question about what the student perspectives were in our schools about this crisis. And so what we did was we conducted opioid focus groups mostly in the fall of 2020 across our 8 different schools and colleges of pharmacy. We ended up conducting focus groups at each of our schools. We tried to conduct focus groups with just P1s together, then P2s, then P3s, and then P4s within our schools. And not all the schools had students that volunteered in each class, so we don't exactly have 4 groups from each school. So we ended up having 169 students from the 8 schools that participated. And we had a subgroup of members that supervised some students from Purdue and Minnesota Duluth that actually helped to look through all of the data from our schools, the transcripts that were recorded, from the focus groups, and identify domains and subdomains. And those were coded using a consensual qualitative research approach, or CQR approach. So you'll see the results are located in the second column here. The demographics of our focus groups are listed. As you'll see, that we had more P1s that volunteered to participate than others. And we have a feeling that some of that was because of the co-curricular credit that some of them could get. But it would vary across schools and just what they had time for in the fall. The genders, obviously there were more females than males. That's what we see in the demographics of pharmacy schools. So we feel like that represents what we see in our schools. Age range was 19 to 47, and then there was also a range of backgrounds as far as their education goes, which the majority of the students had either a bachelor's degree or no degree. And then we had a handful of students that had associates, doctorates, and master's degrees. Domains and subdomains are listed here by the number of mentions. And so the domains are in the left-hand column of Table 2. And the domains that were identified were causes of the crisis from the student's perspective again, overall impact of the crisis, stigma in the pharmacy contributing to the crisis, stigma towards patients contributing to the crisis, solutions to the crisis, education, naloxone, and then sources that impact perspectives. And then you'll see the number of mentions, the subdomains that were most often mentioned, and additional subdomains that were listed. So if you look over at the discussion, again, because of time, I'm not going to spend much time on this, but you'll notice that the domains we have listed under the discussion, and just a summary of the subdomains that were mentioned, and just some thoughts from each of the authors that was charged with looking at each of the domains closely. So, the causes of the crisis, for example, the most common cause of the crisis described by students was prescribers as being the cause, and as overprescribing by quantity and frequency the most often. And also lack of awareness was the second most common cause that was mentioned. And a lack of awareness is assumed by authors to be lack of awareness of the potential for abuse and death that can happen, with patients, the lack of awareness of addiction, for example, by prescribers, lack of awareness by other healthcare professionals as well. Overall impact of the crisis is listed here. We were surprised there weren't as many mentions in this area as we would expect. Obviously, death and overdoses, maybe that don't result in death, were identified. Stigma in the pharmacy and stigma towards patients were also seen to contribute to the crisis. And so there's interesting perspectives from students seen here about the stigma that's directed towards the patients, maybe related to their past use of the medications, those getting early refills, having different excuses as to why maybe they're coming in. And then also, again, like we mentioned, towards patients, that that a lot of times that sometimes they would see aggression from them, so there were, again, different things that were identified, such as socioeconomic status, appearance, geography, that related to a stigma. And so again, stigma overall is something that we're excited to explore a little bit more because we think it's important for us to understand. Solutions that were recommended by students, as well as education, are listed there, and a big part of both of those is just education of everyone about opioid use. Naloxone, and education of our students about naloxone, how to administer it, and the importance of training students about its use, and others. And then the sources that impact the student perspectives, they talked about, obviously they're impacted by their pharmacy school education and the curricula, but also the experiences that they might get with experiential training or their work, as well as personal experiences. We were surprised, maybe not surprised, but we had a lot of students really share their perspectives based on either a family member that had, an addiction to opioids, or personal use of opioids that caused issues. And so we had some really heartfelt responses from students that we were really touched by, to hear their perspectives. So in summary, we think it's important for pharmacy schools to understand student perspectives regarding opioid use, help them prepare to properly address the crisis, and be part of the solution as a healthcare professional. And we think that schools can better prepare students with more skills, training on opioid counseling, naloxone use, and how to have difficult conversations with patients. We also think that schools should collaborate with other health profession schools to provide education to students, so knowledge and understanding is improved across the healthcare team. One of the challenges that we found, that we think we see with our study, is that more P1s participated. So they're going to have a different perspective than those that have gone through pharmacy school. And so the authors plan to break out the information by grade level to further examine the results and perspectives, and then maybe how the curriculum could be affected, depending on the level of the student and their perspective. And so implications, in summary, the results of this research project will be beneficial to pharmacists and pharmacy schools as they educate and equip students to combat the opioid crisis. The project documents what student pharmacists are learning about the opioid crisis and practices they are seeing in their pharmacy experiences, and provides baseline information needed to develop ideas and recommendations to address the crisis. Please don't hesitate to contact me or any of the authors involved in this project, and hopefully we can share more about some of the information as we further examine our results. Thank you, and have a fabulous day.